In 1859, a respectable London woman named Mrs. Whitmore went to see her doctor. She had a list of problems: anxiety, sleepless nights, bad temper, and what she softly called nervous episodes. Her doctor, following the best medical advice of the time, said she had hysteria, and the treatment he gave would make modern doctors lose their license in seconds. He placed her on an exam table and used his hands to stimulate her private parts until she had what he wrote down as a hysterical paroxysm. This was not a street trick or done by fake doctors. It was the accepted medical practice in the best clinics across Europe and America. For over 2,000 years, doctors had treated women for hysteria, which was believed to come from a wandering womb. By Victorian times, the treatment became something that today would sound shocking. Doctors were giving women orgasms as medical therapy, but they didn't even realize that's what they were doing.
The idea of hysteria started in ancient Egypt, but the Greek doctor Hippocrates gave it its name. In Greek, hystera meant uterus. Doctors believed the womb could move around inside a woman's body, pressing on organs and causing problems like fainting or anxiety. Plato even said the uterus was like an animal inside a woman, desperate for children. If she stayed childless too long, her womb would wander and cause trouble. The cure, they said, was marriage and pregnancy. By the Renaissance, doctors stopped believing in the wandering womb, but they kept the diagnosis of hysteria. Now it included almost anything: nervousness, sleeplessness, muscle spasms, shortness of breath, sadness, irritability, too much interest in sex, or no interest at all. Basically, if a woman wasn't perfectly calm and obedient, she was called hysterical. One doctor even said hysteria was the second most common disease after fever, affecting 1 out of every 4 women. Victorian doctors believed women were weaker and more nervous than men. They thought a woman's reproductive system controlled her whole body, making her unstable. Dr. William Acton, a famous doctor, even wrote in 1857 that most women had no sexual feelings at all. This belief that proper women had no sexual desire blinded doctors. So when women came with symptoms of sexual frustration, doctors only saw it as illness. The treatment doctors used was pelvic massage to cause hysterical paroxysm, what we now know as orgasm, but doctors wrote about it in serious medical words. Dr. Nathaniel Highmore in 1660 described it as muscle contractions, a red face, and relief from symptoms. Here's how it was done. Women visited the doctor weekly. They lay on a table, partly undressed but covered with a sheet. The doctor applied scented oils like lavender or rose and massaged the area with circular movements until the patient had paroxysm, sudden muscle contractions, flushed skin, heavy lubrication, and then deep relaxation. Dr. Russell Thrale in 1903 wrote that it could take over an hour to get results. He complained it was the most boring medical procedure. To doctors, it wasn't sexual. It was just like fixing a broken bone, but it was exhausting. Some women needed 1 to 1.5 hours. This treatment was everywhere. By the late 1800s, doctors believed up to 75% of American women had hysteria. Some doctors only treated hysteria, seeing dozens of women every day. In New York, Dr. Taylor's clinic even advertised relief for nervous exhaustion and female troubles. Appointments were booked weekly or every 2 weeks, sometimes for years. Wealthy women could even have doctors come to their homes. Another popular method was hydrotherapy, using water jets at clinics. Patients sat on special chairs while water was directed at them. Spas in England and Germany became famous for this. Women reported feeling full of energy after weeks of daily treatments. By the 1880s, one doctor, Joseph Mortimer Granville, had a problem. His hands cramped from treating too many patients. Massaging for over an hour was hard work. His solution was the first electric vibrator.
it reduced treatment time from hours to minutes. He said it was only for men's muscle problems, but other doctors quickly used it for hysteria. Soon, dozens of vibrator models were sold. By 1900, vibrators were one of the most common electrical appliances in American homes, sold right next to toasters and sewing machines. Ads showed them as medical tools. A 1910 ad even said, "Vibration is life." But no one openly admitted what they were really used for.
The shocking part? Doctors never understood these treatments were sexual. Medical schools didn't teach about female sexuality. Many textbooks didn't even mention the clitoris or said it had no use. Dr. John Harvey Kellogg, the cereal man, used vibrators for hysteria, but also preached against masturbation. Doctors could spend all day giving women orgasms and still believe women had no sexual desire. Some women, of course, knew. Diaries from the 1890s mention women looking forward to treatments with excitement. But medical blindness also caused harm. Some doctors removed or burned the clitoris to stop masturbation. Dr. Isaac Baker Brown, president of the London Medical Society, performed these operations even on girls as young as 10. He was expelled, but only because he did them without consent, not because people thought the surgeries were wrong.
By 1915, American doctors earned $18 million a year from hysteria treatments, about $450 million today. Companies made devices with multiple attachments. Some chairs even had built-in vibrating mechanisms. But things changed with Freud. He admitted women had sexual desires and said hysteria was often psychological. Then, stag films in the 1920s showed vibrators as sexual devices. Suddenly, vibrators became taboo. By 1925, Sears catalogs stopped selling them. Doctors abandoned the treatment quietly. By 1952, hysteria was removed from medical texts. Even after hysteria disappeared, women's health concerns were still dismissed. The word hysterical became a way to ignore women's problems. It wasn't until the 1960s that researchers like Masters and Johnson properly studied female sexuality and revealed the truth. The so-called paroxysm doctors caused was simply orgasm. Looking back, it's hard to believe. How could trained doctors not recognize an orgasm? The answer? Cultural blindness. Victorian society's denial of female sexuality was so strong that even respected doctors missed the obvious. Dr. Rachel Maines later wrote that Victorian doctors were unknowingly giving women the only sexual relief they ever had, all while thinking they were curing disease. The women, meanwhile, knew the truth. This was the only place they could find release. Over 70 years, millions of women received these treatments. If just 10% of adult women had them, and each had 20 sessions, that's tens of millions of medical orgasms performed by doctors who didn't know what they were doing. This history shows how medical practice can be warped by culture. These weren't fringe doctors, they were highly trained, following accepted science, and yet they were blinded. The story of hysteria is one of the strangest chapters in medical history. Doctors prescribed exactly what women needed, but they had no idea.